Good morning, class. So, this is Digestive System Part 2 and this is Module 21. So, ma-start ta sa small intestine. So, small intestine lang ha, don't mind the large intestine. So, this is the picture of the small intestine. So, ano siya, dire. Small intestine na dire nga part. Okay? So, location sang aton yung small intestine is sa lower part of the abdominal cavity below the stomach and surrounded by the large intestine, atong small intestine ha. Then its function is it absorbs nutrients and water from food and sends the remaining waste sa large intestine. Okay? So the small intestine is about 20 feet long and folds many times to fit inside the abdomen. So dako siya, pero mafi-fit siya sa sulod sang aton abdomen ha, aton nga small intestine. Okay, so gintawag siya nga small, kay di ba very small ang mga do tube-like na sila oh. So while the large intestine, dako siya. Okay. Okay, so sa small intestine naton, may 3 parts kita. May kita ginatawag nga duodenum, jejunum, and ileum. So, sa duodenum, about 25 cm long ang duodenum naton. So, where the common bile duct and pancreatic duct empty. So, may ginatawag man kita nga duodenal glands. So, mucous glands in its submucosa which open into the base of intestine glands. So, ang jejunum naton is about 2.5 meters long and makes up 2/5 of small intestines. And ang duodenum ha, 25 cm and aton nga jejunum 2.5 meter long. And ang ileum naton is 3.5 meters long, so makes about 3/5 of small intestines. So sa ileum naton may man ileocecal junction and ileocecal sphincter. Ang ileocecal junction is the site where the ileum connects to the large intestine, and the ileocecal sphincter a ring of smooth muscle that contains ileocecal valve which allow the intestinal contents to move from ileum to large intestines but not otherwise. Okay, so next we have the 4 major cell types of the small intestine's mucosa. So we have the absorptic cells, so it contains microvilli, produce digestive enzymes and absorb digestive food. And goblet cells produce protective mucus, and granular cells help protect intestinal epithelium from bacteria, and endocrine cells produce regulatory hormones that stimulate liver and pancreatic secretions. And we have here the Peyer's patches. So, ang Peyer's patches, secondary lymphoid organs na siya located in the small intestine. So, it contains epithelial M cells. Okay? So, lymphatic nodules na siya that helps protect the intestinal tract from harmful pathogens. So, numerous in ileum. Okay? So, muna siyang mga Peyer's patches. Ang red, ang sa red. Oh. Okay? So, next we have the liver. Okay. So, ang liver naton, ang ara sa module nyo, wala diri masyado ha, pero basahan ko lang ara sa module ninyo. So, we have here, aton, di ba ang liver naton is the largest internal organ that processes nutrients and detoxifies harmful substances from blood. So, produces an important digestive fluid. So, ano na nga fluid ang ginaproduce ng liver? So, it's the bile. So, digestive fluid nga gina-produce ang liver is ang bile. So, aton nga liver, it consists of 2 major lobes. It's, ang muna may kita right and left lobe. So, muna siya. Ari di ang left lobe, and this is the right lobe. So, ang falciform ligament, ari siya falciform ligament, a connective tissue septum that separates the major lobes. So, muna siyang ga-separate sang 2 major lobes naton. Ang porta, the gate through which blood vessels, ducts, and nerves enter or exit the liver. So, di aton mga porta. Okay. Okay. Ay siya, may mga, ano na, dire na siya sa center. And then, next, we have the hepatic artery, hepatic portal vein. Ay siya, dire na, aside. So, hepatic vein. So, these three, it supplies blood, sources of liver that forms the portal triad. Okay, so blood supply sources of liver that forms the portal triad, ang tatlo na. Hepatic cords formed by plate-like groups of hepatocytes and hepatic sinusoids, blood channels that separate hepatic cords. So contain phagocytic cells that help remove foreign particles from blood. So central veins. So ang central veins naton sa liver, it contains all lobes. So, unite to form hepatic veins where the blood from hepatic portal vein and hepatic artery mix together. And bile canalicculus, cleft-like lumen between the cells of each hepatic cord where the bile flows towards left and right. Okay, so wala kita there is an illustration. Sorry, kita may mga hepatic veins. Ay siya ang hepatic veins natin, Hepatic veins, hepatic portal vein, and the hepatic artery naton ang red. The right hepatic artery and the left hepatic artery. So, muna sila. Okay? So, ang functions ng aton liver is it helps support metabolism, immunity, digestion, detoxification, and vitamin storage. So, it breaks down, balances, and creates the nutrients and also metabolized drugs into forms that are easier to use for the rest of the body or that are non-toxic. Okay? So, next. Gallbladder natin. So, this is our gallbladder. Sorry siya, Yan. Gallbladder natin na siya. So, a small sac on the inferior surface of the liver that stores concentrated bile. So, contains cystic duct that joins common hepatic duct to form the common bile duct. So, this is the common hepatic duct. So, connected na sila, This is the gallbladder. So, ang bile naton, dira gina-store ang bile, ha? Or di sa sulod ang bile. So, ara siya, cystic duct naton, this one. And, ga-join na siya sa common hepatic duct. Tapos, to form the common bile duct. Okay? So, this is the gallbladder. Nagid ang functions ng atong gallbladder is for storing bile gidya. Okay? So, stores and concentrate bile. So, ang bile nga na is a substance that helps the digestive system break down fats. Okay? Ano siya. So, next we have the pancreas. So, pancreas naton, complex organ composed of both endocrine and exocrine functions. So, amo ni siya ang aton nga pancreas. So, muna sila ang mga parts. So, this is the gallbladder, ha. Ariaton nga pancreas. Okay. So, dra lang na siya sa may tiyan. Makita niya di sa picture. Sa babaw. So, ano ang functions ng aton nga pancreas? Okay, so, its function is for digestion and blood sugar regulation. So, muna siya ang ga-produce ang insulin, ang aton nga pancreas. Itandaan nyo na, ha, ga-produce ang insulin ang pancreas naton. So, I think mayroon ako ginsend about sa one of the sakit, ang pancreatitis. May ginsend ko sang una sa inyo nga picture. So, you can review that one. May mga ginbutang ko dira sang mga functions ng pancreas. Okay? So next, the exocrine functions of pancreas is ang bicarbonate ions, pancreatic amylase, lipase, and nuclease. So bicarbonate ions neutralize the acidic chyme, which stops the pepsin digestion but provides the proper environment for the functions of pancreatic enzyme. And pancreatic amylase production continues the polysaccharide digestion that began in the oral cavity. And lipase production, a lipid digesting enzyme na siya. And nuclease production, enzymes that degrade DNA and RNA to their component nucleotides. Okay, so next we have the large intestine. So muna naman siyang gasurround sa small intestines naton. So we have here the cecum, o cecum, o cecum, So a sac at the proximal end located at the right lower quadrant near the iliac fossa. And ang sa punta naman sang cecum natin is ang appendix. So, di ba kung maghabok ni siya, mag-inflame, may ginatawag kita nga appendicitis. So, ginakuha ni Dason ang appendix. So, small lang gid na siya. Okay, small lang na siya, but once mag-erupt na siya, once ang appendicitis naton, or ang magka-appendicitis kita, kag mag-erupt sa ton, sulod siyan, so possible magkaka-septic shock kita, pwede mag-lead to death kung mapabayan. Okay, so we have here the muni siya ang colon naton ha, tawag sini colon. So mucosal lining contains crypts, and the longitudinal smooth muscle layers from tenile coil. So consist na siya sang 4 parts. So ang 4 parts nga na ang ascending colon, transverse colon, descending colon, and sigmoid colon. So, makita nyo diya, ascending, transverse, descending, sigmoid colon. So, ang ascending na to extends superiorly from cecum to right colic flexure near the liver. And transverse colon extends from right colic flexure to left colic flexure near the spleen and digestive. Descending colon extends from left colic flexure to the pelvis. And the sigmoid forms an S-shape. S-shaped tube that extends medially and then inferiorly into pelvic cavity and ends at the rectum. Okay, so ang rectum naton straight na siya, muscular tube that ends at the anal canal. So wala na ko di sang anal canal naton. And anal canal, of course, kundiin gagwa ang waste products naton. Okay, so anal canal is 2 to 3 cm of digestive tract that ends at the anus. So, ang anus, muna na siyang external digestive tract opening. So, sa anal naton is, may kita ginatawag nga internal anal sphincter and external anal sphincter. So, ang internal anal sphincter naton is formed by the smooth muscle layer at its superior end. External anal sphincter formed by skeletal muscle at its inferior end. Okay? So, ari siya ang hepatic flexure ni siya or ginatawag nga right colic ha. The sharp bend between the ascending and the transverse colon. So, muna siya ang hepatic flexure or ang ginatawag nga right colic. Okay. So we have here the diseases and disorders of digestive system. We have here the peritonitis. Peritonitis, a potential life-threatening inflammation of the peritoneal membranes, can result from chemical irritation such as bile and infection originating from digestive tract, such as rupture of infected appendix. So, di ba, once nga mag-rupture ang appendix naton, so, di ba, dira ang mga fluids sa tiyan. So, possible magkaka-peritonitis kita. So, ang peritonitis, build up ng mga higko na susulod sa tiyan na naton outside sa aton nga peritoneal membranes gid. Then, tendency do gahabok ang tiyan sina. Okay, sa patient nga may peritonitis. Peritonitis naton life-threatening na siya. So, inflammation of the peritoneum. Tandaan nyo na. So, dental caries or tooth decay. So, results of breakdown of enamel by acid produced by bacteria tooth surface. So, meaning guba nga ngipon. So, periodontal disease, inflammation of the degeneration of the periodontal ligaments, gingiva, and alveolar bone. Most common cause of tooth loss in adults. So, mumps. So, sa may daliog nyo, dapat, diba, sa may kilid, sa may dalom jaw. So, inflammation of the parotid gland caused by a viral infection. Glands became swollen, making the cheeks quite large. So, may result to sterility for male as the virus affects the testes. So, ang ginamin nga may result to sterility for male. So, kung may mumps, ang isa ka male nga patient, so possible ang meaning sa sterility, hindi na siya ka-produce children in the future. So, hindi na siya kabata. Na siya. So, basta sterile na siya. Hindi na siya kabata, hindi na siya ka-produce babies. Okay, so lubaog. Okay? So, heartburn and gastritis. So, meaning gasaka nga acid na siya, diba? Muna siya, painful or burning sensation in the chest. Usually associated with increased gastric acid secretion or backflush of acidic chyme into the esophagus caused by overeating, eating fatty foods, lying down immediately after a meal, consuming too much alcohol or caffeine, smoking, and wearing extremely tight clothing. So, gabalik ang kinaon mo, masuka ka mo ng feeling. So, sometimes, accompanied pa na siya sang chest pain. So, sometimes, sasalaan ng heartburn sa chest pain. Na siya. So, hypertrophic pyloric stenosis, common defect of stomach in infants manifested by greatly thickened pyloric sphincter that interferes with normal stomach emptying. So, signs include projectile vomiting, and fail to gain weight can be corrected with surgery. So, ang HPS or hypertrophic pyloric stenosis, usually ga-affect na siya sa babies between 2 to 8 weeks of age. But it can also occur anytime from birth to 6 months. So, it's more common in males than females, and firstborn male children are believed to have the highest risk. Siya ang pwede makakuha sa HPS. Okay? So, in short, kumbaga, ang pyloric stenosis is like, diba, ang pylorus muscles naton gatikan na siya and become abnormally large. So, ginablock niya na ang food from reaching the small intestine. Okay, muna siya ang pyloric stenosis. Next is gallstone. So, may form in the amount of cholesterol secreted by the liver becomes excessive and is not able to dissolve by the bile salts. So, kung damo na ikaw gallstones, so possible, diba, ginakuha na ato nga gallbladder. So, pero okay man Japon, maskin wala na ta gallbladder kung if ever nga ginkuha gidman. So, basta iwas-iwas lang sa mga high cholesterol food. Okay? So, na siya. So, ang gallstones na siya ang ga-create. So, mga grabe ka pa kanon sa mga grabe cholesterol nga foods or mga fatty foods. Amo na siya, nagkaka-gallstones kita. So, appendicitis, nambal ko naman na kagina. Okay, so muna sila, So, specific point naton is right lower quadrant sang aton nga abdomen. So, McBurney point ang tawag sina. So, may slight fever, loss of appetite, constipation or diarrhea, nausea, and vomiting. Basta tandaan ang sa appendicitis, ang sakit niya sina is sudden abdominal pain at the specific point. So, right lower quadrant asang aton nga abdomen. Okay, tandaan niyo na sa appendicitis. Okay, so usual treatment is appendectomy, surgical removal of the appendix. So, next, hemorrhoids. So, hemorrhoids is, sa term, it's almoranas. So, enlarged or inflamed rectal or hemorrhoidal veins that supply anal canal may cause pain, itching, and bleeding through the anus. So, treatments includes increasing bulk, taking sitz baths, and use of hydrocortisone suppositories. So, mga suppositories ang ginasulod ng mga bulong sa anal naton, sa anus. Okay, so lactose intolerance, meaning caused by absence of lactase. So, kung wala lactase, magiging lactose intolerance kita. So, making ingestion of dairy products results to intestinal cramping, bloating, and diarrhea. So, di ba kung lactose intolerant ka, kung kakaon ka, or giinom ka milk, or may mga ma-eat ka sa may mga dairy products, so, tendency mo sometimes, ma-LBM ka, ma-diarrhea ka, it's because kulang ka sa lactase, ang enzyme nga lactase. Okay? So, that's all for Module 21.